Hello and welcome to Health Talk. I'm Cedric, your host of the program, and today we have with us Dr. Amarnath Sowlee. Doctor is here to answer our questions and help us understand what it is about bone and joint health. Welcome, Doctor. Is there any advice or something that you would give people of this day and age when it comes to bone health?
Yeah, the advice which be given for the bone is one, from the young days you spend some time for your exercise. Or if you're good in sports, best player is a football, best game is the football. So, or running about, you don't have anything to play, you are not in the team or anything, take a round in the ground, 2 rounds or 3 rounds, 800 meters, finish, that is enough. That will keep your muscles, your leg muscles, your bone strength, the calcium will increase. Fourth thing, your heart pumps and it becomes acclimatized. You can climb the steps even, very good thing. So, this is for the young people. So, and avoid straining of the neck. When you're a young man, nowadays even in 25 years age, you join the company, before 25 itself. Because for a doctor, it will take minimum 30 years to build up. So, slow, steady we go. So, if they are very fast and going on, do the neck exercise. Keep your neck erect. Otherwise, you have to wear a collar. That main aim of the collar is keep your neck erect. The back ligament is relaxed. So, you won't feel the stress pull. So, keep your neck erect and do some this exercise, see like this and up and down 10 times. That will keep your ligaments and neck muscles relaxed, you won't get the pain. Second thing is just mild running, the bones, put a circle and keep running for 2-3 minutes, that is enough. And walking, a gradual walking, not fast walking. After 40 years, no fast walking and all. So, after 60 years, general relaxed, swing your arm and walk about that. That will keep you good. And your diet should be, don't take junk foods, avoid junk foods as much as possible. Have good nutritious protein rich diet. For vegetarians, I'll advise them, you have that, what do you say, that peanut sundals, we call it as sundal in Tamil. So, take sundals as the best protein diet and have all good leafy vegetables, green leafy vegetables and perandai, they call it in Tamil perandai, that is very rich in calcium and other things. And what I say is take plenty of buttermilk or milk which has plenty of calcium in that. And what more do you want is for non-veg people, you can have the bone soup, a little bit of chicken. I don't advise the mutton or beef and all. It's have high cholesterol levels.
Okay, doctor.
So, it's better you take chicken bone soup, like that it will be better. Non-vegetarians. Vegetarians is more than enough. Green leafy vegetables and peas, peanuts and other things, and this will be okay. And my little exercise, walking, all that. Be happy, cheerful. Once you're more happy, forget your jobs. Saturday, Sunday relaxation, go out with your family. Good.
Milk always seems to be a recurring theme when it comes to bone health and calcium as a whole. What can lactose intolerant people do with that, Father?
Lactose intolerant people, you have to, soya beans milk is there. You use that soya beans protein thing, that will increase about gradual little things. Not necessary you should take milk, but other ways of calcium is there. Have that lady's finger thing, then drumstick, or plenty of calciums in that. You take every alternate day, you have that. Then drumstick leaves, 100% you take it as soup form, take it as raw. What do you say that you take it as a drumstick cooked up things, it will be better. Nowadays, you get even drumstick soup. When you go to a star hotel for that other thing, you have drumstick soup. I say, Nada, we have that 𝗏𝗏𝗃𝐽 soup.
Yeah.
Oh, fine. That is a poor man's high calcium diet. So, that is fine about it.
Okay, doctor. So, what are the common challenges that you face in your line when you see people approaching you with problems of bone?
Main problem people come down is for nowadays because of the increase in the IT stress strain. One, neck pain, back pain and knee pain. They keep constantly sitting in one place, the knee bend. That causes the knee pain. So, now and then often stretch your legs, stretch up exercise. Just go for a small walk, 2 to 3 minutes walk and then come and sit up. That is one of the knee pain I see very often. Most of the people, even below 40 years, knee pain, myalgic pains are there. Second thing is they have the neck pain because constantly bending and working and posterior ligament gets stretched. For that, you have to do mild neck exercise. That will help them. 2. 3, and lack of proper diet. They just take junk foods on and off, eat there and work. That is not good. Spend some time for your lunch. Have good nutritious soup and other things. Mild little bit and it will be okay. not to overstrain, not eat quantity of rice now. Little bit with protein diets will be good, or egg per day. Vegetarian, non-vegetarian can take egg and all. Vegetarian people have some good cucumber, tomatoes, all that can. You want a little bit spicy, have that capsicum in that and have it. Good.
What are the
nuts and all nuts you can have. Best people they can have nuts, pista, badam, everything. Little bit, a handful. Even cardiologists advise that good for heart. Not so much. 10 grams of peanuts, 10 grams of pista, badam. That is good. Little bit small quantity is very good for you. Everything that's what they advise is 𝗤𝗂𝗂𝗪𝗿 𝐵𝐵𝐵𝐵 விஷம். So that should be followed. Little bit quantity, control it, fine. Carry on like that. That goes on.
So carrying a proper trail mixes to your work, IT professionals can help them with their bone health.
Relaxation and mental stress strain can produce osteoporosis, weakness of your bone. Avoid the stress. Whatever is there, stress. These people carry home the tension. That is wrong. Once you step out of your office, forget about it. Leave it, whatever is there. You are not the next person will come. Not that everything is resting on your shoulders.
They work in office. When they go home, they work from home, doctor.
Work from home, that's right. People? That is very bad. You play with your children, go home, play, take some table tennis, take some carom board, all that. Chess, I don't advise them to go home because you have to work your brain. That isn't all not okay. Not good that. You do mild exercise, gym, walking, or watering your garden, plants, everything. That helps us a lot.
What are proper indicators that people of working class can look out for just to know their bone health? Because bone health seems to be very neglected. People care about the heart, their diabetes and all that. But bones seem to be very neglected these days.
Because even with elderly people, even with the bone pain, they have knee pain. Oh, because of the age it comes, they'll drag on. Early stage detection is good. Once you see start getting bone pain or mild analgesia, everything applied ointment, if it's not bringing it down, immediately take an X-ray and see or consult an orthopedic surgeon so that you can find out the inner part of the joint will be reduced. That is an indication that later if you leave it, if you neglect it, you will go up to knee replacement. That can be avoided. You take proper X-rays, proper diets, and if it's still not coming down, please consult your nearby orthopedic surgeon. He will guide you.
Sure.
That will be better.
And how viable and how necessary is a knee surgery when a person is neglecting his knee health very much?
Yeah, all persons don't require a knee surgery. We have to see the stage. There are various stages in the knee. Suppose it's in stage 4, definitely they have to be replaced where the cartilage is damaged beyond repair. So early 1 and 2 stages we can give them cartilage forming tablets. Stem cells have come, we can inject that in the joint. Then steroids can be given to the joint, grade 1 and grade 2. Grade 3 is cat on the wall. You do the exercise, tablets and other things you can do it and exercise, see whether you are able to recover it. Still it is not happening. Then only we have to see if it is grade 4, complete joint space. There we can see people going out bending with a swing gait, that is a waddling gait, like a duck gait they have. So that only when that stage has come means the joint is fully more or less 80% destroyed, which recovery is very difficult and they'll have severe pain. They cannot squat on the ground. If they want to go to the temple and sit down, they will not be possible. Elderly people like to go to the temple and other things. That will be very difficult for them. So for such people, you can correct the deformity. You can put, nowadays it has come at a very economical rate and government is also sponsoring. You can have the joint, if you are fit, your cardiac status is good, if it's above 50%, you can easily have that, and the bone strength is okay, we'll have it undergo replacement where they can have a straight erect walk, painless walk and stable walk. You can have that. That only stage 4 condition, you are fit, your heart is fit to undergo the surgery. It is just 1 hour's time nowadays. And the 3rd day we make them to walk and go home, climb steps and down everything. They'll be happy. They'll be very happy.
Understood, doctors. This is a 3-part question actually, doctor. What are the common problems that people face in different age groups, like A, infants, B, adolescents, and C, the older people? What are the different problems they face depending on the age and the activities they perform?
Yeah, that's a good question. In infants, now it will be because of the deficiency of vitamin C and vitamin D causing rickets, bow legs. We can make out from them, their intelligence will be slightly less from that itself, and we can see the the wrist bones will be swollen, so big. That is where the calcium is not deposited because of vitamin D deficiency. Vitamin D is necessary for absorbing the calcium from the intestine, which is not getting absorbed and deposited in the bones. So, as a result of which there will be, without calcium, you take an X-ray, lack of calcium indicates in black things, and bowing will be there in that thing. That is an indication for in infants. Most of the causes in a younger age group, and congenital rickets are also there from the time they are born. Because of deficiency in the mother, the calcium deficiency in the mother, the baby will be affected, for which we give arachital strong injections of vitamin D3 that can increase the absorption of calcium. Gradually it will come. Then in children, there is known as nutritional rickets. In nutrition rickets, because of poor intake of food and vitamins, they have a deformity in the bone, bowing of the legs, then bent bones, and pain in the bones will be. The vitamin C is lacking, means there will be pain in the bones because of the bleeding in the joints, bleeding in the gums. That can be causing them pain. For them, give them citrus fruits, vitamin C, citrus fruits, all have lemon, then amla, and so many rich in oranges can give them, that is slowly cure them, vitamin C. And more common things in children is running and falling down and fractures. That fractures can be easily corrected once you take the X-ray and define it. And nowadays they want to go very early back to the school. Very early, we will tell them to have a small rod to be kept inside. What I advise them, because I studied in Anglo-Indian school, St. Mary's I studied in St. Mary's and then Loyola. So the school will start at 9:30. It will be really excellent. Go slow. Have a good breakfast in the morning. That is nowadays. The children, everything will skip their breakfast and go. Just have a tumbler of milk and go. That is not good. Have a good diet. Have a good breakfast. At least two slices of bread and carry on. Or at least 2-3 idlis. 2 idlis. That will be good. You should have a good nutritious breakfast where you will be active in the school. Otherwise, the children go to the school, they will start sleeping at 11 o'clock itself. That is not good. You should be provided with the good nutrition in the morning. That will make them strong. This is a common in children. In younger middle age groups, because of the stress, strain, running, jumping, back pain comes fast. And because of the motor drive and speed race and other things, fractures. They meet with fractures, so many things. And middle age group, what we see a patient get, most of the people, sometimes they have a back pain, they neglect it. Oh, it's because of weakness. No. Sometimes the tuberculosis can affect them. Because work strain, you lose your resistance. Once your resistance goes down, you will easily be attacked by tuberculosis, where it will eat away the bone. The tuberculosis bacteria will eat away the bone. So, as a result of slow bending gain, you will feel very weak, you lose your weight, you lose your appetite, everything will start. So, that can come in the younger and middle age group. Then at the above 40 years, you will start slowly getting low pain, knee pain and back pain. These are the common causes. And above 60 years, the first thing we will see, when any patient comes for any pain, we will try to rule out malignancy, if the cancer is affected or not. So, there are so many cancer problems in the bone, which with the early stage if detected is curable. Before olden days, some 25-30 years back, curing a bone tumor with a cancerous thing was very difficult. My chief used to say, once you have a bone tumor carcinoma, you are already one step in the graveyard. So, that is now gone, and we do it, and we will put an artificial limb and make them to work. We excise the bone and do it. That has come now, latest stage where it can be cured. You should be knowing John Kennedy's brother. He is the longest survival of the bone tumor, osteosarcoma. Still that literature is there. He was survived at a very early age, they detected and put him, and he is fine. John Kennedy's brother, younger brother, he survived that. So early detection, good proper treatment, followed with chemotherapies. Now it has grown. The chemotherapies and other thing, cancerous thing has grown very well. Even blood cancers, everything detected early can be cured. They can have a longer life. Nowadays, the average Indian age is above 65. Before it was below 50 and all. Now it is above 65. That itself indicates that we have a good. India is improving, developing not only in economical but also in health. That's the thing going on.
We had discussed about IT sectors having back pain and neck pain. Apart from IT sectors, what are the other profession-related bone injuries that you see, doctor?
Sports people, hockey players, football players, all those people, they keep on getting ligament strain. So they keep on running. The joint, knee joint is the main thing getting affected. Ligaments goes from the tibia, lower leg bone, to the upper thigh bone. Ligaments is holding them. Not the bone is just there. It is being tied with knots and ligaments. That ligament, once it's cut, he loses the stability of the knee. So he can climb up with adjusting trick movements. But when he gets down, his knee will buckle and he'll fall down.
Okay, doctor.
That is the rupture of cruciate ligament. Now that we have that, we see diagnosed with the MRI. And once the cruciate ligament is torn, we advise them surgery. It's really hardly 45 minutes we do it. So through arthroscopic surgery, we replace nearby ligament. There are 4 or 5 ligaments in the knee joint, the posterior aspect. We'll remove one ligament and reattach it. So what is cut, we don't suture it. New ligament is given so that the stability comes. Okay, so he can run, walk, other things and all. So it goes on. Okay. Because you know, when 𝗬𝗏 Shastri long time, when they went to South Africa to play cricket match, he got hurt. His ligament was torn. He was advised rest, but he played. But then he lost his full profession. He was not able to walk and he put up weight and other things. So get early treated, replaced it, ligament. It is only hardly 45 minutes and it's good. We have latest titanium screws to be kept there. So very easily it's curable. And third day back to your work.
Okay, doctor.
That is ligamentous injury causes on sports people, that is mostly young middle age group.
So what are the other professions, doctor? Is there anything else? Is there any other profession that handles a lot of bone stress?
Bone stress, no. See, sailors, because of the vitamin deficiencies, they learn for scurvy and other things was there. Now they have been replaced well. And daily exercise, they come here, people near Georgetown, where I study in the school, St. Mary's there, they keep on playing. The sailors come and play football there. So that is a good sign. You have to play, keep yourself active. So most of them are now study, join in IT. Early job, early studies, early job, early money. So that gives on that. So and other professions, stress strain induced bone osteoporotic. You keep on studying, sitting in a place, not going out in the sunlight. Indoor games, no. Outdoor games is the best. At least weekly once or twice you have to go there and play. So that will strengthen the bone and the muscle. The muscle will get more power. More power in the muscle will put more power in the bone. So nowadays they go for night match also. Yes, I have seen night matches they play. That's nice. Anything, you keep yourself active. IT players go for the night matches. That's good also.
Is there any other advice you would like to provide the audience in essence regards to bone health?
In bone health, take nutritious diet. Simple nutritious diet is more than enough. No need to go to 5-star hotel or big hotels and all. Every day try to have some green leafy vegetables. 1. Protein diet. Vegetarians have sundals. Non-vegetarians have whatever fish. Cheap and best for them is fish to have the protein diet. Chicken does not increase the weight. It won't increase the weight, but same thing, protein is good. And what more you do, mild everyday 10 minutes exercise or 15 minutes exercise. Those who can't do the exercise active things, walking. See, suppose you have to take a second floor or third floor. Don't take the lift. Climb up. That will give you a quadriceps muscle, your power to the knee, power to the hip, spine, and your to heart. That keeps pumping. It will get acclimatized. So you go for the third floor other things. Till 60 years you will be active. That's more than enough for you. Then gradual exercises. So that is a mild exercise. If you take steps or you go using a bike, pull the bike and go for at least a half a kilometer. Walk, talk with your friend and walk along with the bike. Don't immediately start your bike and go away. Or keep your bike at a distance and then go there and get it up. That will be better things. Or bus stop also. Don't take near your house. One stop away or half a stop away. That will be walking, doctor. Is the best exercise. That's what I advise.
Understood, doctor. Yeah. So just to summarize what we discussed in the entire year, so we have to have the IT professionals and anybody who sits in one place to carry with them a trail mix of groundnuts, peanuts and everything. Yeah. Have a cup of milk and an egg if you are non-vegetarian every day morning. For lactose intolerant people, we could do with soybean milk. And bone health should be taken care of with proper exercise. And the star sport of the day would be football then.
Yeah, so, mild is football, walking, or you can't play BS and an umpire or badminton. They play badminton. That is good. Jumping, this and that. The only thing badminton players get injured. relaxed, and young people recover very fast. Not after 50 years. Don't go for football after 50 years. No, your joint will be stiff, ligament will tear. So what you said is well said.
Yes,
Maintain
doctor.
mild, good, nutritious, exercise good, be tension free, be happy. The bone will also be happy.
Understood, doctor.
Yeah.
It was really nice spending time with you, answering all my questions patiently. Thank you, doctor. I hope all of them follow that, and also hope bone health is something that's given its necessary attention.
Yeah, thank you very much. Not only patients and other things, even doctors should follow.
Yes, doctor.
Doctors we see nowadays getting more stress and strain. So relax, Saturday, Sunday off, keep your duty doctors. You go for walking, relaxation, see movies, enjoy yourself.
Sure,
That's
doctor.
good.
Understood, doctor. Thank you very much.
Thank you very much, Thank you.
nice
Yeah,
meeting
good.
you.
Yeah.